Hello everyone, we are going to record the first video for the midterm pictures label, and special contribution in this video is done by the two students named Wajid Ali and Muhammad Shaheen. Thank you guys. Our first picture in this video is the posterior view of the gluteal region and the thigh region. Here we can see the two main arteries of the gluteal region, the superior gluteal artery and inferior gluteal artery. Except that we can see here the femoral artery and the deep femoral artery. The deep femoral artery is giving the medial and the lateral circumflex artery. This medial and lateral circumflex artery making the anastomosis around the femur. Except that it is having the first, second, and the third perforating artery. Next picture. Next picture is showing the nerves, in which we can see here L1, L2, L3, L4, and the L5. This side we see that anterior ramus from the L1 to the L4. This nerve from the L1 that is coming downward, that we can say ilioinguinal nerve. This one here, that is the lateral cutaneous nerve of the thigh. This large one is the femoral nerve, and beside that is a small one, that is the femoral branch of genitofemoral nerve. We got here from the obturator canal the obturator nerve. In this side we got here lumbosacral trunk, and this tiny one superior gluteal, and this one is the inferior gluteal nerve. And except that we got here the nerve to the quadratus femoris and the obturator internus here. And this one very tiny here, that is the perforating cutaneous nerve. This small one is the posterior cutaneous nerve of the thigh, and this large one is the sciatic nerve. The next picture, we are having the anterior and the posterior view of the thigh. We got here the external iliac artery. After crossing the inguinal ligament, it changed into the femoral artery. And then in this part we can see here the femoral artery is cut, but its main branch, what we call that deep femoral artery, is present there. Except this picture is having the muscles. We got here psoas major iliacus. This cut one is a sartorius. This is tensor fasciae latae. And then the cut one is the rectus femoris, one of the hand of the quadris subfemoris muscle. And then vastus lateralis, intermedialis, and medialis. After that, we are having here the pectineus, and in this place, this cut one is the adductor longus. Under that, we are having the adductor brevis, and this one is the adductor magnus, in which we are having the hair hole adductor hiatus, and the most medially, this one is the gracilis muscle. From the posterior view, we can see the piriformis. The cut portions are representing our posterior compartment muscles, but we call them the hamstring muscles. Okay, and here we are having the adductor magnus muscle, which is representing here adductor hiatus, from where the femoral artery will pass through and go to the posterior side, and it will change the name here as the popliteal artery. One thing here, except the three perforating artery. This one is the terminal or the end artery of the deep artery of the thigh. The next picture is mainly talking about the muscles. Again, the same muscles we talked about just now, the quadriceps femoris muscle, sartorius muscle, and from the medial compartment we can see here pectineus, adductor longus, and then we can see here the gracilis. And here we can see the section in which we can see anterior compartment muscles, okay, and the medial compartment and posterior compartment of the thigh muscles. One extra thing here, articularis genis are small muscles from the anterior compartment, and here this green dot is representing here the subpatellar bursa. In this picture, we can see here the posterior view of the leg. We can see here the sciatic nerve, adductor hiatus, letting the femoral artery and the vein to pass through and change them into the popliteal artery and the popliteal vein. Then we see here the sciatic one is having here the tibial and the common fibular part. And this small tiny branch of this nerve from the tibial, this is the sural nerve. We can see very clearly in this picture also. And this place here, we call that the calf of the leg. And we got here the tibia. This tibial nerve and the posterior tibial artery and the deep one is also the tibial vein. They are forming the content of the tarsal tunnel here. The next picture we got here the knee, in which we can see here most anteriorly, first of all, the patellar ligament attaching on the tibia, and here this is the fibula bone. Under this ligament we can see here the infrapatellar fat. We got here the meniscus, medial lateral meniscus respectively. We got here anterior and posterior cruciate ligament. And in this diagram, we can see here the quadriceps femoris tendon and also articularis genis muscle here. We can see the patellar bone, femur, and the tibia, and we can also see here the prepatellar bursa, and downside here the subcutaneous and the deep infrapatellar bursa. And under that we are having the infrapatellar fat over there, this yellow color. Ankle ligament or ankle joint ligament. This is the medial side and this is the lateral side. In the medial side, we are having the most anteriorly, this part here, that is the anterior tibiotalar, and most posteriorly, this one is the posterior tibiotalar. And here we got here tibionavicular and tibiocalcaneal ligament. These four ligaments on the medial side, also known as deltoid ligament of the ankle. On the lateral side, we are having anteriorly anterior talofibular ligament, posteriorly posterior talofibular ligament, and here inferiorly calcaneofibular ligament. The next diagram here, we can see this is the third layer of the sole of the foot muscles. We got here the flexor hallucis brevis muscle here. We got here the adductor hallucis with its transfer and the oblique head. We got here the flexor digiti minimi brevis muscle. except that we can see here tendon that is coming from the fibularis longus muscle, this one. And here we are having the tendon of tibialis posterior muscle, this one. In this picture, we can see the anterior view of the foot, mainly talking about that we got here the anterior tibial artery, which will change into the dorsal pedis artery. On his course, anterior tibial, both sides is giving the branches as the anterior medial malleolar and the anterior lateral malleolar artery. This place here, it is giving the medial and the lateral branch from the dorsal pedis artery, that sometimes also from the anterior tibial. So this place here, they are giving the supply to the tarsus bone, so we call them the medial and the lateral tarsal branches. It is forming the arcuate artery here and continues anteriorly and giving the metatarsal artery, and this one deeply is going, that is going to the deep plantar artery, this one. After that, we are having the interosseous muscles over there. Okay, first, second, then a third. Okay, and except this, what else we can see here? We are having the dorsal digital arteries here, and these are the extensive retinaculums, because the muscle tendons, those that are present here, they are extensive, so that extensive retinaculum. The last picture from this we are having here, that is talking about the sole of the foot again, but this time we're on the arteries. Posterior tibial artery here is giving the branches as medial side. We are having the medial plantar artery, and the lateral side we are having the lateral plantar artery, which one is also forming the deep plantar arch. After that, we are having here the plantar metatarsal arteries and then digital plantar arteries. Thank you.